Do you use your mobile phone more than 5 hours a day? If so, you may be at risk of several health issues, including obesity. Hello, my successful and healthy earthlings. Mihaela Ragush here, naturopath and founder of the Natural Health Podcast. In today's episode, I'm going to share with you the link between your phone and obesity. I'm going to go into detail about phone use here in Australia, how much it's grown, and also the link between your phone and obesity, and then how to avoid phone addictions. And at the end of this episode, I'm going to give you an opportunity to join a health and success-oriented community by joining the Natural Health newsletter, clicking the link below. Welcome to the Natural Health Podcast, where we bring awareness of sustainable health in a business hustle space. Natural Health Podcast is perfect for the high-performing, business-minded individuals who want to work with their biochemistry to achieve optimal health and success. It's Mondays with Mihaela. That's right, me. Thank you so much for tuning in. Absolutely love, and appreciate your support. On Mondays, I'm here to provide you simple, savvy, and sustainable health hacks to optimize your health. Today's episode, I'm going to be talking about phone addictions and a possible link with obesity. Who would have thought? I mean, obesity has risen here in Australia absolutely dramatically in the last few years. But who would ever think that there's a link between phone use, screen time, and obesity? To start off, I thought, let's look into phone use here in Australia. Some absolutely amazing statistics that I'm going to share with you. It's going to blow your mind of how much we use our phone. So text messaging, email, video games, that all help build our sedentary society. And I've spoken about how being sedentary actually affects your health in negative ways. We sit, we text, right? We sit when we email, most of us. Most of us also sit when we play video games. Most of us also sit when we have a phone call. So we stand for a moment and then we sit back down again. So that means we live a very sedentary lifestyle whilst on our phone. Our dependency on smartphones, I love how it's called a smartphone, not a dumb phone, has increased so much that it seems difficult to spend one day without a smartphone. When was the last time that you had 12 hours without your phone? Does even the thought of that give you anxiety? Does the thought of being without your phone make you feel anxious about your work, about your loved ones, even about yourself? 12 hours without a phone, what does that look like for you? In 2017, the number of smartphone users in Australia was around 18.6 million. This number was forecasted to reach 21.5 million by 2025. That actually represents a smartphone penetration rate of 80% in the country. To Australians, a mobile phone is a smartphone which does more than just phone calls. When we think about a phone, it makes a phone call. But here in Australia, we use it for a lot more than just using a smartphone. Spending too much time on a smartphone facilitates sedentary behavior, reduces the time of physical activity, increases the risk of premature death, diabetes, heart disease, and different types of cancers. Who would have thought that I'm going to tell you that by you using your phone, you may have premature death, you may get diabetes, you may get heart disease, you may get cancer. Yes, that's right. That's exactly what I just said, right? Not just me, but the research said that. So essentially, let's have a look at here. Beautiful graph done by Deloitte Mobile Consumer Survey in 2018. Which of the following devices do you own or have access to? For anyone who can't see the graph at the moment, smartphone is 89%, laptop is 76%, desktop is 52%, a large tablet, which is over 9 inches, is 43%, a small tablet 7 to 9 inches is 27%, fitness band 19%, portable games player 14%, e-reader 12%, standard mobile phone, not a smartphone, only 11%, smartwatch 9%, and a virtual reality headset 5%. So this shows to us that at any given moment, most people have access, 90% or 89% of people have access to a smartphone. That is a lot of individuals. Now let's have a look at, this is absolutely amazing. It's done by Hootsuite. They looked at, in January 2020, Australia, as you can see the flag there, daily time spent with media. Using the internet, it was 5 hours and 41 minutes. That's the daily spend, the average from people aged between 16 and 64 years of age. Using social media was 1 hour and 44 minutes. Watching television was 3 hours and 15 minutes. Streaming music was 1 hour and 8 minutes. And using a game console was 50 minutes. So, average amount of people using the internet is 5 hours and 41 minutes. That is absolutely mind-blowing. That is a lot of time. Here's another graph looking at a share of the web traffic by device. So we're looking at phones, right? Smartphones, January 2020. Australia, mobile phones, 47.5%. Comparing it to December 2018 to December 2019, it went up 25%, right? What went down was the use of laptops and also the use of tablet computers, right? And also other devices. So that is absolutely extraordinary. As you can see, mobile phone is by far the number one way people access social media. Not only 98% of social media users access via mobile, 60% of Facebook users only access the social media via smartphone. Now that you know the data of what's happening here in Australia and smartphone use, which has risen dramatically, I'd love to see the stats for this year, especially with everything that's been happening in the whole world, with lockdowns and so forth. I'd love to see how much that's impacted our smartphone use. Bet you went through the roof. So let's have a look at the link between your phone and potential obesity. This is a mind-blowing link. Obesity is one of the best documented outcomes of screen media exposure. Many observational studies find a relationship between screen media exposure and the increased risk of obesity. So this isn't just one study, not two, this is a number of studies. Current evidence actually suggests that screen media exposure leads to obesity in children and adolescents by increased eating while viewing, exposure to high-calorie, low-nutrients food and beverages, marketing that influences children's preferences, purchasing requests, consumption habits, and reduced sleep duration. So these are the way that it impacts to obesity. So number one, it said high-calorie, low-nutrient food and beverages marketing. So specifically to kids. So kids, while they're watching screen time, while they're watching ads, they're exposed to high-calorie, low-nutrient foods and drinks. So they're like, that's going to mind play with their preference of purchasing these foods and also consuming habits, but also it reduces their sleep. And reduction of sleep, what's the number one thing for you to lose weight? Sleep, right? So does screen media exposure lead to obesity? What an amazing question. And I guess that's what you're here for. That's why you tuned in to the Natural Podcast, listen to this episode. A number of possible mechanisms are thought to explain the effects of screen exposure on obesity, right? These include displacing physical activity, increasing energy intake from eating while viewing, or the effect of advertising and reduced sleep. So they're saying that there's a number of ways why individuals lead to obesity with screen time. One of them is that they are actually, because when they're on a screen, what did I talk about? They're more sedentary. So they are actually displacing physical activity. They're also increasing the energy intake from eating while sitting. And when you're eating while sitting, you're not really making a connection that food's going into your mouth. So you overeat, right? And also reducing sleep. Much more evidence supports screen time media on energy intake as a prominent mechanism linking screen time with obesity in children. So this is saying that actual kids, specifically kids in this instance, but can be put into adults also, is that their energy intake is through the roof when they are watching TV or when they're on their phone. Epidemiological studies reveal that children who consume more screen media also consume less fruit and vegetables and more dense snacks, energy-dense drinks, and fast food. Receive a higher percentage of their energy from fats that have a total high energy intake. And like, look, I'm here to tell you that just because calorie in does not mean calorie out does not mean calorie in, all that stuff. It's got to do with hormones and so forth. But if you're not eating if you don't have minerals and vitamins in your body, which these foods don't provide you with the adequate minerals and vitamins, your body's not going to be functioning the way it's supposed to function, especially the hormones, right? Eating while viewing is one important way that screen time exposure increases children's energy intake. Studies have revealed that children consume a large proportion of their daily calories and meals while watching screen media. This is a study that came out, right? So I actually looked at one study in particular. So researchers have found that students who use their smartphones 5 or more hours a day are prone to higher risk of obesity and are likely to have other lifestyle habits that increase the risk of heart disease. That's scary, right? So I looked at one study. It looked at 24,800 high school students in between 2013 and 2015. This is a little bit of an older study, but imagine what the effects would be now, right? So the results showed that 20% of participants used other screen devices for 5 hours or more daily. Using smartphone, tablet, computer, and video games is associated with several obesity risk factors. Full stop. And how? I just said it earlier. Through reducing your physical activity by sitting, a sedentary lifestyle. In addition to that, eating more high calorie, fat, dense snacks and food, and the reduction of vegetable and fruit and minerals and vitamins. So when we look at it deeper, you're actually not giving the right minerals and vitamins for your body to process the food that it's supposed to process, right? So essentially, using your phone for more than 5 hours a day, I would even say less than that, unless you are eating broccoli. This is specific to this. Unless you're eating broccoli, I don't know why broccoli, but it came to my mind. Walking whilst using your smartphone, then you may have a less risk, right? But most people don't do that. Who do you know that has a bowl of broccoli whilst on their smartphone? We shouldn't be eating while looking at a screen anyway, but does that and then goes for a walk whilst on their phone. Not many people do that, right? So essentially, these are the things that affect that the link is between using your phone and obesity. There's a clear link, especially here in children. Let's look at 3 tips to avoid phone addictions, because if we're avoiding phone addictions, we may be reducing our risk for obesity. Number 1 is keep the notifications off. And this also has to do with the dopamine receptors and so forth, which I can talk about on another podcast. Great topic I can talk about. So keeping your notifications off keeps you off your phone, because you're like, your thing might be going off, but you're not interested because your notifications are off. Number 2 is have a phone-free day. And if you can't do a whole day, do 6 hours, 8 hours, start with a few hours first and see how you go. These are key to not be addicted to your phone. Number 3 is keep track of your phone usage. There are a lot of apps out there that keep track of where you spend most of your time. Review it. Be like, wow, I spent so much time on reading the news. I spent so much time on YouTube watching natural health podcasts. I spent so much time doing this. And then you can review where you want to spend your time, because if you don't know where you're at, how you're supposed to improve. So these are 3 tips to avoid phone addictions, which essentially will reduce your chance of being obese. So there you have it. If you absolutely loved this episode and you want to share it, please feel free to share it. Do what you do best. Love, like, share the Natural Health Podcast. If you want to be part of a health and success oriented community, click below, join the Natural Health newsletter every Friday. Bonuses, specials sent straight to your inbox, and it is only for VIPs. Only people who are subscribed to the newsletter get access to these codes. There you have it. And remember, the missing link between failure and success is your health. Content and information provided here is opinion of Mahela Raguse and is for information purposes only and does not constitute medical advice. It is not intended to provide medical advice or take the place of medical advice or any current treatment you're undertaking. Consult your own medical professionals for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the Natural Health Podcast. It is advised that you consult your doctor or healthcare professional in relation to any health concerns you may be having. Mahela Raguse does not take responsibility for any health consequences which occur from a person listening, viewing, or reading this content. And in no circumstances shall the Natural Podcast, Mahela Raguse, any guests or contributors to the Natural Podcast, or any employees, associates, or affiliates of Mahela Raguse be responsible for damages arising from the information provided on the Natural Podcast. By listening to this podcast, you agree not to use this podcast as medical advice to treat any medical conditions in either yourself or others. Please note, if you're taking prescription, do not stop your medication or start a new protocol, including but not limited to supplements, diet, lifestyle changes without consulting a doctor or healthcare professional. If you or any person has a medical concern, you should consult with your healthcare provider or seek other professional medical advice. Never disregard professional medical advice or delay in seeking it because of something that you have read or heard on the Natural Podcast or in any linked materials. If you think you may have a medical emergency, call your doctor or emergency services immediately. Neither Mahela Raguse nor the publisher of this content takes responsibility for the possible health consequences of any person or persons reading or listening or following the information in the educational content.